Hi there. A few of you reached out to ask me if I had anything else to help drain the sinuses, and I do. So I will share this one with you right now. I had pneumonia recently and I found myself doing this one every hour, and it was very, very helpful. So you're going to find your collarbones, your clavicles, those bones that stick out in the front here, with all four of your fingertips. You're going to slide down off of that collarbone until you come to land on the next bone, which is your second rib. So you're gently hooking on almost to that second rib on both sides. Okay, so on our inhales, you're going to imagine lengthening through the crown of the head and base of the skull. So it's like you're trying to get as tall as you possibly can through your whole spine, but particularly through the neck and back of the skull. At the same time as you gently draw those second ribs down towards the floor. So you're creating an opposition between crown of the head, base of the skull, and that second rib, okay? So find that landmark, slide off your clavicles until you come to land on your second rib, hook on a little bit. Inhaling and exhaling through the nose if you can, but if your sinuses are blocked, you may have to do that through the mouth, and that's perfectly fine. So inhale, slide those ribs down towards the floor as you lengthen through the base of the skull and get as tall as you can through the neck. On the exhales, you just soften those actions a little bit. So watching me, you're not going to see much change because we're talking millimeters. Inhale, you get long through the back of the neck, reach the crown of the head to the sky as you slide those second ribs down to the earth. And on the exhales, you're releasing. Keep going at your own rhythm. Every inhale, you're creating that space. Every exhale, you're gently letting it go. So we're creating a bit of a pumping action. And one of the reasons why it works so well is around that second rib, we have a lot of, we call it a vasomotor zone. There's a lot of arteries, veins, nerves, and lymphs around this area, some of which are responsible for draining the head, neck, and face, which is why it works. So if this is helpful for you, and for myself, when I had a sinus infection and I did this, after 1 or 2 repetitions, already I found myself able to breathe through the nose where previously I could not. And then, as I said, I was using it roughly every hour, and I would do 6 to 10 breaths. For me, that was enough. If you find you need more, you do however many feels appropriate. Let's do 2 more together. Last one. And then it's always nice after any practice, any kind of movement or awareness practice that you do, to just check in with your body before and after. So do a couple of breaths here in neutral without trying to affect or change anything, and just see, does it feel differently than it did when we first started?